I will describe my country as a place of warmth, relaxation. People who are very vocal. We like to talk a lot. We are a small island, 133 square miles, which includes the islands of Petit Martinique and Carriacou. There is a tendency among the population in general, not just in the area of dentistry, to only go for medical care when they have a problem. They do not see it as something that you need to do as a routine. In other words, the same way you celebrate your birthday by buying yourself a gift, you may celebrate your birthday by making sure you have your annual check, the same way you pay your insurance premium on your house and your car. And it's something we're trying to get people to buy into, that your health is your responsibility.
So the original survey that was done in Grenada was by PAHO, and it was done 10 years before we got there, and I believe there was a survey even done 10 years before that. Those two surveys and our surveys were very, very similar. We used the WHO survey, Pathfinder survey, and Mark Wolff and a group went and got a sample of the children in the country. There's 26,000 children, and they got just over 1,000 children. And the results of that survey showed that there was a really crisis situation.
One in 3 children were missing a tooth due to dental decay. We found that virtually no children had fillings, no restorations had been placed in their mouth. And the average child on Grenada had 6 additional surfaces that were demineralizing.
I can speak from my perspective as well. I mean, I never knew as a child growing up to anything about visiting a dentist, let's say for cleaning or any kind of thing like that. I just didn't know that. What I knew was you had a bad tooth and it was pulled out. When you start getting pain or there's an abscess, you start crying at home, and my mom, took us to the dentist. Then it was just to be pulled out.
After we got the data, we analyzed the data, we looked at possible responses, and made a decision that we couldn't drill our way, as Mark would say, out of this problem, and we needed to move in a preventive aspects. The preventive aspects were a combination of things, and it was basically school-based in nature. We were going to go in and have a toothbrushing session each day for 2 minutes with fluoridated toothpaste, and Colgate, again, one of our main sponsor, and really, really helpful in allowing us to do this. That was followed by fluoride varnish 3 times a year, and that was followed by getting sealants on teeth so that grooves and pits were sealed, preventing decay.
The importance of the school-based program rests primarily in sustainability, because there simply are not enough dentists in Grenada to treat the disease that is present. So starting in the schools, starting with prevention, focusing on education, establishing good daily oral hygiene practices, beginning at 3 years old, beginning in preschool. As soon as those children enter into the school system, brushing your teeth becomes a normal part of your daily routine.
Treatment is always the more expensive option, and so if we could catch them children as that group at an early stage, then we think that we would have, in a sense, prevent further damage being done later on, because it is always more costly at the end to do treatment.
Beyond the school-based program, we are trying to reach the community and trying to reach the general public in Grenada in any number of ways. 2 of those are PTA meetings and training sessions with the community health nurses. PTA meetings are organized by each school respectively, and there may be 20 parents, there may be 200 parents that attend these sessions. But every time we get the opportunity to send one of our team to present to those parents, we take advantage of it.
One of the critical components that I like very much about this program is the focus on getting the kids involved in having an appreciation for the importance of dental health. I think a lot of times that is left out, and we forget that the mouth is the port of entry for nutrition and for everything else that happens in the body. And you would find many parents may not spend a lot of time getting their children to brush their teeth properly. They don't see it as a very important thing. And I think that is changing with the public education that's happening. And this is something that the program has brought. Now that we are preaching prevention and NYU is partnering with us, you are seeing more and more parents who would take their children to the clinic. And again, this we hope will continue and will expand, and people will really buy into it, that it is important to have that happen.
It is probably the best time to brush your teeth after meals. But some of the students, I believe we're still in a situation where some students don't do that at home. And if we can inculcate that in them from at a school level, hopefully it would be transferred to the home, and they would get into the habit of brushing their teeth, not only in school, but out of school, also at the home.
It is practical. What they're doing now is practical. We're not just telling them to brush their teeth, but we have the things there for them to brush their teeth. So I think they learn best by doing.
I think it's a very good initiative. It will help with the health of the students and helping them to get their dentals in order, keeping their teeth and everything healthy for years to come.
The school-based oral health prevention is something that can be transported to other countries. The daily toothbrushing routine, the fluoride varnish routine, the sealant routine, those are components that can be taken and replicated anywhere in the world. They can be used in developing countries to address oral disease issues. They can be used in developed countries. It's something that could happen in classrooms around the world to really change the way that people approach their own oral health and hygiene.
In the long term, this program has the ability to accomplish a population that is more dentally more aware, more educated about the oral health matters, have the correct information to prevent tooth decay from the parents' point of view and the children's point of view. And I think this program can have a very bright future for the children of Grenada. I think it has a lot of potential to make a difference in reducing the incidence of dental caries here on the island.
It's a new consciousness. It's a new awareness, a new empowerment that has taken the island, island-wide, Grenada, Carriacou, and Petit Martinique, through the school population, the teachers, and the parents. And I believe that with all that is happening, all that has happened, whatever will happen, even if the project comes to an end, the continuity of such a program, because of the awareness raised, will last a lifetime. I'm sure about that. It has impacted my life. I know it has impacted the lives of students. They are looking forward for the start of this program again as we begin this September. So I know for a fact that even if you're gone, the children will be aware of what is happening. Definitely.
Our hope for the project is that it will be a solution, that it will provide the Grenada Ministry of Health and Ministry of Education with a solution to their oral disease burden. We hope that they will take the components that we have introduced and that we have worked with them to implement and continue that long term and focus on preventing oral disease rather than trying to treat it.